Hello, I am Isabel Nagyat. I'm 27 years old and I'm an entrepreneur from Angeles City, Pampanga. I learned about CSA medical aesthetics from my family, my titas and my mom, because we are avid CSA babies. We are, you would say, suki kami ni Doktora, and we've been her patients from CSA in the U, and up till now that she moved to CSA in Infinity, we still followed her and we are still her suki. So my main concern for visiting Doktora today is I hope to address these acne scars, my adult acne, especially because I am an aspiring flight attendant, and I do hope to have better looking skin, and not only better looking skin but also healthy skin, so that when I apply to my future airlines, I could have presentable skin and I could really represent the brand or the airline very well with my nice skin from Doktora. So I hope you all enjoyed this video, and don't forget to like, subscribe, and hit the notification bell to get notified whenever Doktora posts a new video.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest. Let's all welcome Miss Isabel Nagyat.
Thank you, Doc.
Right.
Thank you. Hello, everyone.
Isabel is not new in CSA. First time here in our channel, in our segment,
Yeah.
right? But she has been coming to CSA since high school years.
Days.
Yeah. And the common problem when you're in your teenage years, acne, right? So we started with acne treatment. She was doing some anti-acne facials. And then, as time passes by, some of the acne, they persist, Well, ideally, acne should stop around when you're 20s already. There's an 80% of this population of young ones, they stop to have the acne by that age. But there's a 20% that retain acne problems. Okay, and acne has multiple causes. Okay, so it's not just during your teenage years when you start to have these hormonal changes in your body, right? It could be genetics, and then hormonal again. Especially for women, our monthly cycle, we get this so-called hormonal acne. But there are other factors causing acne as well. There are medications leading to acne problem, acne from steroids or acne from some oral medicines that people are taking. And then there's also this so-called tropical acne. I don't know if you've heard of tropical acne. Some foreign people coming to countries with this, the too much heat, summertime, humidity, then suddenly they get acne, particularly on body parts like the back area. So we call that tropical acne. There's also acne cosmetica from the use of makeups. Okay, mechanical acne, mechanica from the manipulation of the acne problems. Some pomade acne. So some men using those hair greasy substance thing. So some of those greasy materials, they can go to your skin and clog the pores. So some of the types of acne. Now acne problems, we also grade them according to severity. It could be grade 1, grade 2, grade 3, grade 4. Of course, those severe ones, they already have the so-called the cystic nodular acne, inflamed acne. Now inflamed acne, usually these are the ones that will leave a mark, an acne scar. That's why as much as possible, if you start to have comedones, blackheads, whiteheads, treat them right away. Don't wait for them to get inflamed. And if they're inflamed, don't manipulate it. The more they get inflamed, and the more you'll have acne scars. Okay, that's why we have some medications that we prescribe for like staging of this acne, and we have some treatments in our center whereby we can control them, and we have to still classify the kind of acne you're having and rule out any causes. Of course, not only treating the signs, the symptoms, but also to manage the cause, target the cause. Like if it's hormonal acne, we have to give some hormonal therapy as well, okay? So sometimes it's like women who have this PCOS, if you've heard of the PCOS, polycystic ovarian syndrome, they're prone to acne formation. And women using a lot of makeups, we advise them, of course, to, as much as possible, reduce the use of it. Yeah. Stressful lifestyle. Puyat. Yan, we are like, ano yan, guilty tayo dyan. Okay. So also another concern is like the acne marks, the acne scars, okay? And acne scars, we also classify them. So there's this ice pick scar, boxcar scar, rolling scar, undulating scar, or there are scars that are just flat. They just have the discoloration or just the pigmentation, or like a hypertrophic scar. Yung reverse naman ng atrophic scar. So every type of acne scar has different kind of treatment. Okay, that's why here we have to target the specific scar and give the specific treatment for that scar, an optimal treatment for that one. So ano kayang gagawin natin ngayon? Okay.
Parang all of the above yung scars ko.
All of the above.
All of the
Okay.
above.
So I'm excited to treat Isabel on this problem. We'll show the procedure when we return. And we're back. So we're with Isabel. Okay, I'm assessing her skin right now. So on this side here, left side, we notice some active acne lesions, right, Isabel? And then we have some acne marks, acne scars. So they're mostly on the mid-face section and extending on the lower third of the face plus the chin area. So if you are assessing on the skin condition, looking at the acne, the location of the acne, they're basically on this kind of like on the mid-face to the lower face, or we call it the U-zone. So the U-zone is where the acne lesions and active acne problems are, and most of the time when it's U-zone, it's hormonal etiology, or the cause is associated with hormonal things. So if you look at the forehead area, the nose, okay, so you'll see a bit of some comedones, closed comedones, okay? But mostly the active lesions are on the U-zone area. Right, Isabel? So, of course, we also need to prescribe you with some topical, something to control the acne, stop the activity of the sebaceous glands, control oiliness, also target the Propionibacterium acne, plus stop any inflammation. And in our clinic, what we recommend right now for acne scar treatment at the same time with active acne lesions is our device we call Eladerm. This is radiofrequency microneedling. So this is a colorblind device. It doesn't like affect any chromophore. It's chromophore independent. So it's good for all skin Fitzpatrick type. So from types 1 to 6, okay? Plus this one, it has the radiofrequency. It delivers that optimal temperature to be able to reach the dermis, and at the same time restore volume there, stimulate our fibroblast cells, regenerate the tissue. So it's a good device. Like you don't have to wait for the active acne lesions to go away. You can already use this. Plus the radiofrequency thermal temperature can also target some of the bacteria, okay, the microbe, and it can zap any inflamed acne lesions. So I'll start. So I have my device here. I'll be working on the forehead region first. And the good thing with the device, actually it has a so-called cryo spray, a cryogenic anesthesia. Okay, I'll start with this part here, and then I'll start with my first shot. Okay, so there you go. How was it? So far, so good. Yeah. So a while ago, we cleansed the skin, we applied numbing cream, and you can leave the numbing cream for about 30 minutes to even an hour. Okay. So we can also target those fine lines for people who have static wrinkles. They can have this kind of treatment just to get rid of the static lines. Okay, so not only for acne scars, but it's also for those saggy skin, loose skin. So if you want to rejuvenate and regenerate, this is a best device for us. So I also need this for myself, anti-aging. There you go. So we create micro channels with the micro needle. So this has 25 pins. So you can target the skin dermis, the papillary and reticular dermis. And you can even work around the eye area for those people who have like wrinkles around the eye. You can target those concerns. Large pores as well. You can even like solve the problem of having dilated pores. This can tighten or like make the pores kind of like not so visible. So, ang daming benefits, no, Isabel, right? So far, so good?
Yes.
Yeah, okay. So, the green light tells me that it's ready to have this micropins go inside the skin layer. And when it's in a blue color, it means to say it's targeting the deep layer. So again, we're using the Eladerm. And after creating those so-called microchannels, you can deliver your exosomes, your skin boosters, your amino acids, vitamins, minerals, non-cross-linked hyaluronic acids, and other growth factor peptides. Infuse them inside your skin to also help improve the quality, texture, and tone of our skin. So again, you're creating microchannels, and it's good for the so-called transdermal drug delivery. We call that TDD, transdermal drug delivery. So we want to target this area here because we have this acne scars here. So I can do a second pass on the problem area, and I'm already seeing erythema or redness. That's the endpoint. So once you have that redness, it means to say we were able to fulfill our goal. Okay. So this is a good treatment. Especially Isabel is turning how old?
28 po.
Allah. Aging starts at 25. Oh,
That's
no.
true, that's true.
Yeah. So at that age, you may see some appearance of like dynamic lines.
I noticed.
Yeah.
My cheeks, there's
Cheeks.
acne. It's in our family, yung ito po.
Nasolabial fold.
Yes.
There you go.
And my eyes,
Droopy.
may wrinkle.
Yeah, under eye lines and wrinkles. Yeah, that's
Tsaka yung
expected to
forehead.
happen. Yeah. So
Kasi madaldal ako, so.
yeah. We're not
When
doing
I talk.
if we're not doing anything, then aging will just progress. So this is a good treatment. So not only managing the aging signs, but also prevention. So we can target marionette lines, nasolabial folds. So this is a very good device. I think this is already a must device for aesthetic centers. Like it can really target a lot of skin concerns, young and old. Ayan. As young as Isabel. Okay. So from high school, no, to early adolescence, late adolescence, early adulthood. Yeah. So parang this is a lifetime relationship.
Yes.
There are relationships that will last. I believe in that.
Yes.
So we're working on the right now mid-face section here. I'm targeting active acne lesions, and I'm working also on the acne scars. So this is a device that you can actually combine with, for example, if you have exosomes, you can directly apply it. Even before the micro needling, you can do the application already of your exosomes. So we call that dry micro needling. Or after doing this, you can already apply your exosomes, your skin boosters, your topical solutions, so they can really be infused inside the skin dermis. Well, skin dermis is a very important environment in our skin tissue because it's the one that contains all those cellular components like fibroblasts that generate or synthesize your collagen, elastin, and some of the protective cells are there, like immune cells are there. So we want to also prevent any age spots, you know that? Senile lentigens, they call it, or lentigos. So this device can also prevent formation of any dark spots because it repairs your basement membrane. Because right now in pigmentations plus melasma, they attributed it also to basement membrane disruption, leading to so-called like melanocytes protruding in the dermis of the skin. So we're almost done. We are delivering how many shots already? So I could say that this could be a lunchtime treatment. Like if you have a break, you can come here because the redness will be very temporary, because after this we're still doing the so-called helite So I could say no downtime for this one. And very tolerable treatment. There you go. So after this, I'll be giving again a second pass for the scars here. And usually when we're doing this, we see already like an improvement for the first treatment, 20 to 30% case-to-case basis. So some of my patients were telling me, Doc, I already have 30% improvement during my first treatment. The others were even saying 50% improvement. So depending on the age, the younger you are, the faster your recovery is, and the faster your skin will still regenerate. The earlier you start, the better. Prevention is better than cure. So this is a very good device, and no side effects, no worries, as long as, you know, done by trained practitioners who understand the skin condition, right? And let's go to the nasal region to improve the skin here, skin quality. Then after that, I'll be using solutions like a combination of exosomes and some, you know, peptides, amino acids, vitamins, minerals, all the important micronutrients for our skin cells to regenerate. So actually, I got the Dr. Celdermis. It contains a lot of good ingredients that's gonna be helping our skin regenerate, revitalize. Plus, also kind of like if you have active acne lesions, it will also help in the repair. And it's anti-inflammatory as well. So if you have inflammations, this one has a fast healing and anti-inflammatory benefits. So the good thing is we already have micro channels, so I'm just gonna be giving a drop of this combination skin booster and exosomes. Exosomes are like bags of messengers, cellular messengers, and messengers, they kind of like go into the skin cells and tell your skin cells to, hey, time to regenerate, time to repair, time to revitalize. So they're like messengers, and they're good because they will really help in the repair, healing, and regeneration, and improve the skin quality, get rid of the acne problem, and those who have other conditions, acne rosacea, apart from acne vulgaris, acne scars, aging skin, sensitive skin, and also those with a lot of lines and wrinkles, sagginess, laxity, aging skin, all of the above. And pigmentation, concerns of melasma, cloasma, lentigos, lentigenes, dark spots. There you go. So we have a transient erythema here. So we'll still do the so-called Helite and also our soothing gel and the modeling mask. Okay, so that's it. And we'll show the result to Isabel when we return. And we're back. So let's show the result to Isabel. Isabel,
Yes.
expect redness initially,
Yes.
but actually in a little while, the redness will go away because we will still do the device called Helite. It's a low-level light therapy that's gonna make the redness go away faster. Plus, it will still improve the skin quality, the skin condition. And we did the application of like the exosome combined with skin boosters. So little by little, I'm actually already noticing little by little the redness is getting lesser and lesser. So, how was the experience of the Eladerm treatment?
Ano lang siya, yung
Yung
parang may
parang
dumadaan lang
Dumadaan lang.
na needle.
needle,
Pero
yun.
parang wala lang.
Yeah.
Yung, inantok ako.
Ayun.
Inantok.
Hinantok
Ang ganda
siya.
din ng boses nito eh.
Ay, salamat. Yeah. You know, in our procedures, we incorporate the so-called tocesthesia. So like when I'm doing a treatment, we explain while I'm explaining, and they kind of feel relieved.
Yes.
Somehow
Effective.
it's like yeah, tocesthesia.
It's soothing.
Soothing, yan.
Tsaka I'm learning.
And learning at the
Pero
same
kasi,
time.
ang sarap. Talagang nalaman ko yung benefits ng one machine na
Right.
usually you get one treatment for scarring, one treatment for acne, iba't iba. Pero
Right.
ito, all in one.
All in one.
Any age. Yung iniisip ko, my mom will like this, my dad will
Yeah.
like this. Yun yung iniisip ko.
For all ages, for all
Yeah.
skin types. Yun. So yung aking toxicity siya, again, it also will distract you. Nakaka-distract din dun sa thinking of what we're doing with the treatment. Right? So, good thing that we have the device here that's really treating multiple skin concerns. Yan. Yung iba sabi, skin imperfections. So, like, we can target like aging skin, we can target acne scars, acne problems, large pores, like even for those like with rosacea or telangiectasias, okay, we can do the treatment of this one. Even if you have active acne lesions, we can already do this kind of treatment, okay? So, the acne scars, either it's blemish, atrophic, or the hypertrophic. Well, with the hypertrophic, we still combine with something to flatten the hypertrophic scar. Ayan. And even like not only on the face, neck area, some body parts with loose skin, we treat that with this Eladerm, even stretch marks. So body parts na you see a lot of wrinkles, lines, sagginess, laxity, stretch marks, scars, all kinds of scars. And even like they also reported about using this Eladerm for hyperhidrosis, excessive sweating, axillary. So they have a report on that one. And even cases of like, if you have even melasma, epidermal, dermal, or mixed type of melasma, you can also benefit from this Eladerm because of the collagenesis and elastogenesis, dominance of the fibrous proteins, and somehow getting rid of the melasma, some of the molecules of melasma or melanin pigments that aggregated because they're being like you overcome them with this anti-inflammatory effect plus also those fibroblast activation. Yan, dami pala, no?
Yeah.
I need it also. Like, I've done a treatment of this one too, and then the result that we've noticed is like, there was a lifting and tightening. So, it will also help those with concerns of like, sagginess here, jowls, or this nasolabial folds, marionette, or the cheek ptosis. Yeah. So, more benefits from this one. And usually we do also like sessions of this one, okay? Like you've done one right now, and usually 2 to 4 weeks we can appreciate results. I had cases of active acne. Like 2 weeks they sent me a photo. There's a reduction of the active acne lesions. So like weeks later you'll appreciate all the benefits that this machine can devise. Actually the red is becoming pinkish. And in a little while, it's gonna become lighter because we will still apply post skincare treatment, yung mga post-care steps. So we have the soothing gel. We also have the low-level light therapy. Then they'll put on some modeling mask and then sun protection as well. So after this, you have to put on those post-care skin treatment and don't come out without sunblock.
Yes.
Okay, it's important to protect your skin with your SPF 50 sunscreen. Okay, and the recommendation is to use the physical sun blocker, so something that will shield your skin from the ultraviolet wavelengths, UVA, UVB, yun.
Yeah.
All of the above, yan. So like we'll do an interval of like every 2 to 4 weeks of this one, or once a month is fine. So for every session, you can see 20% to 30% improvement. So if you do 3 sessions, 5 sessions, then we'll watch out. And see the improvement. Imo-monitor po natin. We'll show you the results like after this first session, second session, third session. And you'll be sharing with us photos.
Yes.
Like day 7, day 14, you can share with us. Okay? Or even share with us like day 1 to day 3 to see the redness if they are totally gone. So that we could say that there's really no downtime to it. Right? Thank you so much, Isabella.
Thank you, Doc.
Usually, skin recovery happens in 2 weeks' time, okay? So, we give time for that 2-week period for the skin to regenerate. Thank you so much, Isabel.
Thank you, Doc.
Ayan, getting better and better now while we're talking.
And it feels so tight and plump.
Yeah. There's also that sensation. It's tightening from within. So, it's working inside, but you'll see the result outside. Ayan. Thank you so much. If you have questions, you may email us at csaskinclinic@yahoo.com. Our FB page, CSA Medical Aesthetics. Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other videos. Look at our channel, Contessa Salvador. And please do click the like, subscribe, notification. Okay. to keep you updated. So thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.